This video is about hydroxychloroquinone, a drug that was very often talked about a while ago as a treatment for COVID-19. So what is hydroxychloroquinone? Hydroxychloroquinone and chloroquinone are drugs from the same class, and they are tablets that are taken by the mouth. It is most commonly used to treat malaria, and treatment is given before and after travel to an endemic location, which is a location where malaria is common. So why was it proposed as a treatment for COVID-19? On March 20th, 2020, a French observational study was published in the International Journal of Microbial Agents offering hydroxychloroquinone as a possible treatment option. It had very exciting results. This study showed that hydroxychloroquinone is efficient in clearing viruses in SARS-CoV-2 in COVID-19 patients in only 3 to 6 days in most patients. When another agent named azithromycin, which has been previously shown to be active against Zika and Ebola viruses, was also added, almost 0 patients seemed to have positive samples of viral load in this study. So why was this not such a good option then? Multiple studies have now shown that this study was flawed. The study was small, not randomized, and patients who got sicker were simply removed from the study and not taken into consideration. One of these studies done to disprove the previous one was done in Brazil and examined 81 hospitalized patients. Patients in the trial also received an antibiotic. Half the study participants were given a dose of chloroquinone twice daily for 5 days, and the rest were prescribed a higher dose of chloroquinone for 10 days. Within 3 days, the researchers started noticing heart arrhythmias or an irregular heartbeat. Their normal heart wave looks like this, with a Q face and a T face and an interval between them. However, in these patients, they seem to have a longer interval than normal, leading to a very irregular heartbeat. Even though the antibiotic itself that was also added in the study is associated with a few adverse heart effects, the effect is usually mild and not as drastic as these patients presented with. Another study performed in the U.S. Veterans Association on 368 patients evaluated showed these results. HC stands for hydroxychloroquinone. HC and AZ is hydroxychloroquinone with the same antibiotic that was used in the Brazil study as well. And no HC is the patients that were not treated with hydroxychloroquinone and were rather given standard treatment. As seen in this table, the death rates are as follows. The lowest death rate was seen in patients that were not given hydroxychloroquinone. In addition, the NIH also mentions that there is insufficient data about the efficacy of hydroxychloroquinone and chloroquinone and recommends against using the high-dose versions. It only supports the usage of these drugs in clinical trials. Additionally, as mentioned before, this medication is used to treat malaria. Taking it as an unproved treatment for COVID-19 puts the patient at risk for side effects and also decreases the amount of medication available to patients who need it as a proven treatment for other illnesses like malaria. To learn more, visit publichealthcoalition.org.